Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness Podcast with me, your host, Dr. Deborah Durst. So I have some guests with me. Well, they've been with me for another podcast, and I had them both back to talk about hormones with us. So Christina is going to introduce herself, but basically came to us on a professional level and getting to know each other. We started talking about hormones, and so now we are doing her hormone replacement and optimization. So I had her on just to talk about her experience with hormones because we love to have women talking about hormones. You know, they would rather hear it from women that are actually going through it, and they've heard a lot of it from me because I'm right there too, but they love hearing it from actually, you know, women in the beginning stages of it, or if they're further in and they've been with us for years. So I'm going to let Christina introduce herself, and then Marissa as well, and then we'll get started.
My name is Christina McCann, and I'm actually a new patient of Dr. Durst for hormone therapy.
Hi, I'm Marissa Staten. I'm the medical esthetician and laser technician.
And also, you know, knows all about hormones too.
And a patient, of course, of Dr. Durst.
Yeah, we might recruit her to talk a little bit about it as well. You can't just be an esthetician. There is no such thing as Marissa being a just anything, but but true. Yeah, no, absolutely true, right?
Very true.
So tell me what you had found, you know, in your experience prior to even coming to us, like what you were experiencing, you know, what physicians you had seen just in the regular course of, you know, of preventative care, and then what kind of, you know, guidance your primary doctors or your OBGYN doctors gave you.
So I've actually probably been having problems with hormones for a couple years, and I will kudos my doctor who told me that I needed to find somebody who specialized in it, because you know how family medicine is. They deal with so many different things that they're not truly an expert when it comes to hormones, and she told me that. So like I said, I kudos her for that. It was really funny, though, that I came to your office and I can't remember how we started talking about it, but I had gotten some misinformation from somebody else that I was seeking out to get hormone therapy from and to work with. And you totally cleared it up, and it made me interested even more in doing it, just for the fact that you told me I didn't have to come off the birth control that I was on.
I agree with you. When the primary care doctors actually refer on, you know, instead of just scaring patients. So that's the first step, you know, because some of them will just say, you know, oh, that's unsafe, you shouldn't be on it. You know, little things like you have a clotting disorder, you can never be on hormones. You know, they're very general in their information given. And sometimes, again, I was traditionally trained, so I don't fault them. They just don't know, you know, and so I would rather them refer on to somebody that does and relinquish that, you know, that area of their of the patient care to somebody that is specializing in it, until they would decide to, you know, take that that specialty area on. So I really love when primary doctors or even OBGYN doctors actually just say, you know, listen, go to somebody that specializes. It's like going to a surgeon that does surgery. I wouldn't do surgery. You're going to refer on. So if you don't know it, you know, scaring patients and giving them misinformation is not helpful. And sometimes they don't feel well, right? So we go through little changes. Sometimes it's not huge changes. It could be little things. Were you having any sleep issues at all?
Absolutely. And I think mine were little issues, Dr. Durst, that kind of built up over time. And it's kind of funny because she's been telling me for multiple years, at least 2 or 3 years, that I probably needed to see somebody about hormones. And I'm just so glad, because I think there's a lot of doctors that don't talk about hormones either, and about how we need hormone replacement as we age and go through, what's it called? Perimenopause?
Perimenopause.
Yeah. Yeah. So I think it's definitely something that I was experiencing. She knew from the complaints I had of being tired, the fatigue, weight gain, right? You were even talking about on another one of your podcasts about weight gain within the stomach area. Is a huge sign of that.
Central weight gain is definitely, you know, where our belt line is. And again, if you set women around a room, and we say this all the time, like they're going to say the same things, is, brain fog, energy, lower libido, sleep is an issue, don't handle stress as well as they used to, weight gain, body composition changes, that abdominal area, behind the arms, bra fat area, above the knees, and women will go through the same thing. They'll be nodding their heads, yes, about all these symptoms or changes that they're experiencing as well.
And let's not leave out anxiety too. So there's a huge topic that has come up so much because of COVID and the world that we've lived in. But I think it's pretty wild too, since going on therapy, how much my anxiety's gone down.
Yeah.
And I think that a lot of it was just my hormones and the misfunction
Well, when you're talking about perimenopause, I generally say 40 to 55. It can be earlier, depending on pregnancies and childbirth, or if they've had surgical, procedures done, then you can enter perimenopause or menopause earlier than usual. But then perimenopause, you're going to drop progesterone and testosterone. First to drop in progesterone, you can't sleep, you don't handle stress as well, and you get more anxious over things that never made you anxious before. And of course, COVID is a time where I think stress in general is going to decline your hormones, and because it's going to cortisol instead of your sex hormone production. So it's shunting down the stress pathway anyhow. And so that's a huge change with COVID because you need more cortisol. It's very stressful. I mean, people, if you're watching anything, the whole point of all of that is to make people more fearful instead of, realizing that we only have control, over ourselves and our attitude and our own bodies. And so the more we're stressed and fearful about things, the more our immune systems are going to be affected, our energy, our sex hormone production, all of the above. So progesterone will drop and they'll go to their primary doctor because they can't sleep, and they're placed on anti-anxiety, sleep medicines, and antidepressants. And really what they need is progesterone. So that's a big thing. And then testosterone is the second one to drop in perimenopause, which again, the weight gain, body composition changes, libido, no sex drive or low sex drive.
No sex drive,
brain fog, energy.
The brain fog's horrible.
Yeah.
Well, and you think, why can't I remember this stuff that I always remembered before?
And sometimes it's a more insidious where people don't really realize, how bad it is. They'll come in for one specific thing. Like, so say women don't have a sex drive. And again, when we talk about birth control will actually drive down the binding protein that binds testosterone. So your free testosterone is not as available to work. And drug companies, do this fabulous thing of like finding a way to have a patent on something, for other indications such as lowering acne, and so if you take your free testosterone down by increasing that binding globulin, then you basically decrease acne as well. And so they'll have different ways. And so your sex hormone binding globulin can go way up with different birth controls depending on which one you're on. And then your free testosterone's low. So a lot of women on birth control will end up having a lower sex drive, which is, again, a huge sign of perimenopause. Weight changes, brain fog, but it can be more insidious. So sometimes it's not until you get treatment that you really realize the other things were there too, like brain fog, energy, all of that. Yeah.
Yeah. And I think the energy, I just was thinking I was worn out from working all the time. Right. And I think I just thought it was normal of aging. So that's what I'm here to say. It's not normal.
It's not
and
normal.
I think because my twin will even say that, Chris, I really just thought it was just normal of us aging. It's not normal. And you actually can get help and you can actually feel good again.
Better.
And I'm here to tell you that because I do. I feel so much better.
Yeah, most women don't realize that they actually can feel better.
Yeah.
They just automatically say, well, it's just
this
aging.
is it. This is it.
aging.
This
Well,
is what I'm left
what are we going to do about it?
Yeah.
Nothing.
Well, they don't know there's options there. And then frequently if they see their primary doctor, or an OBGYN, they don't get those answers or solutions. So really, 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 a lot of times patients are more proactive in this area than providers and physicians because they don't want to feel like that. And, they do a little searching and they realize they don't have to. And so they're seeking those solutions. So they're a lot of times more proactive than even physicians at giving them the solutions when they're asked those problems. And then again, when you talk about low sex drive as a woman to an OBGYN doctor, you're not often going to be presented with a lot of different solutions with that because we're not taught that in traditional medicine.
No, we're not.
So, and testosterone in women is definitely one of those areas that we need to address more firmly.
But how strange too that we would think increasing testosterone, why, you know what I'm saying? Like I think there's a lot of people out there that are like, really? Because even in the conversations that I've had about having pellets, been given testosterone, they're like, women, we need testosterone? What would we need that for, right? So I think there's a huge uneducation portion of it. And once again, kudos to Sarah Mullins, the nurse practitioner I've been going to for years. I've been going to her for years. Kudos to her for being like, you are just being on top of stuff like that about you're having hormone issues. You need to go see somebody who specializes in it to make me think to do it.
I think it's awesome when they do, when they guide and give that up to somebody that specializes in it. Because sometimes they just don't do it the right way and optimize the way you should be. So again, women are under the misperception that they're going to look manly. If they're on testosterone, they're going to grow hair.
Oh, yeah. Is it going to make you grow facial hair? Oh, my gosh.
Or is my back going to be full of, hair? And so that's not the case. And obviously it doesn't make women more masculine either. And it's the most circulating hormone in a woman's body too. So it needs to be optimized. And it's a life force for men and women. And there's low T clinics on every corner, and there's no low T clinics for women. And so it's a gender bias for sure, that women just need to accept, those changes. And, compounding pharmacies are an option for women for, progesterone, for estradiol, for testosterone. Pellets are an option. Those are things that, again, are sometimes they want to regulate those a little bit more, but those are the only options we have right now. There's no FDA approved products for testosterone in women. And again, why? Because that's a gender bias right now. It's went unaddressed and it needs to be addressed more firmly, And so, yeah, I love that she sent you on. And then there's pellets, you can do injectables, typically those are the two routes we go, not too much in the way of creams because we've talked about, all about skin. It's hard to get things through the skin and actually get them absorbed to the point where, it's going to make you feel better.
Especially something for testosterone, right?
Yes.
Like you think about our skin and our face with ZO, we're exfoliating and we're getting those products where they need to go. And it's a little bit different. You got to do a lot of
work just to get them to where they might go.
Do.
Yeah, no. And it's definitely a fluctuation with creams and it's not absorbed as well. And so, there's pellets and injectables typically that we're going with and optimizing. And again, controlling all the things that might cause side effects. So we have some goal levels and some symptom control. And, we just make sure people are feeling good and no side effects, and that's what our main goal is. And then, you're due. Christina's very early on in it. So we're, every 3 months or so, we'll check blood work again and, between 3 and 4 months replacing pellets. And how was the pellet procedure?
Very easy. Rachel did an amazing job. Honestly, through the procedure, I never felt it. But that's something let's talk about seriously. I think the other thing that was so wonderful about coming to see you was how easy the process was.
Good. Let's talk about that.
Let's talk about that. And because I think people think, oh, it's another visit, it's another this. The process was so incredibly simple. I came in, you did blood work. I came back like a week later. We looked at my blood work, which looked amazingly low.
Amazing.
I had nothing.
Amazing.
I had nothing.
Not
Amazing.
optimized.
Amazingly good, except for the hormones, right?
Yeah, except for hormones. Yeah, you're right. My blood work looked great, except for my hormones.
Yeah.
But seriously, we did it. It took, 20 minutes maybe max. Rachel she's precious. She did a great job. I couldn't feel any of it.
Yeah. No.
It wasn't painful. I was in and out.
Mm-hmm.
I left. That's the other thing too, though, is I left, and I know you talked about this on one of your other podcasts, but about the vitamin D. And I can't stress enough, after working with and in bone previously before coming here and working for ZOSkin Health, but how much vitamin D us as women need to be taking.
Oh, yes. Yeah, absolutely.
And I got that from you, along with another multivitamin, I think. I can't remember exactly what it was.
Probably the Phyto-Multi.
Yep.
Mm-hmm.
That's exactly what it was.
Did you get a shot of vitamin D in the office too?
Probably. I'm pretty sure I did.
Yeah.
You did?
You got a couple shots that day.
I got multiple shots that day.
Yeah.
Yes.
So again, vitamin D is so important for lots of different things: anti-cancer, brain health, bone health, heart health, pregnancy support, like mood, weight loss. But immune system support is huge right now. And so most people are low, even if it's in the summertime and they're out. You really have to be almost naked for 8 hours a day. Peak sun to even come close. Like, we're all low.
Yes,
our skin just doesn't convert it the way. So we will do shots to get people up and then put them on a significant dose per day.
But why do we want to go out there and risk the fact of being out there in the
right?
sun long enough to get the vitamin D? Because then we'd all have melanoma, right?
Correct.
Exactly.
Yeah.
So,
Then
I mean, we have to worry about skin cancer. Yeah.
Yeah. No,
So.
absolutely. And then you can boost people up. And then again, being immune optimized right now, we have not talked enough about COVID and immune support that we can do. Like, what can we do to support ourselves? And we haven't talked enough about that. And so vitamin D is one of those things.
Absolutely.
People have to be, again, no one in the ICU for COVID that had a level greater than 30 for vitamin D, which is a very low level. We're like optimizing much higher than that. So have we heard that? Do we talk about vitamin D and how important? And we haven't. And so anyhow, we look at that with all of our patients for sure. Give them
And
shots
I did listen to that to your podcast that you did on vitamin D, and that is pretty interesting, actually.
Yeah.
So
very
there's
interesting.
another reason. I mean, not only for the fact that, when you look at the stats of older women over the age of 65 who fall and break a hip that die within a year, I mean, you're talking like 65%. It's unbelievable.
Yeah.
The immobility, it's huge.
Over 50% for mortality after a hip fracture within a year. And so the issue is this. The only thing that's going to keep your bones strong are hormones, which are estrogen, testosterone, progesterone, or vitamin D, which is really a prohormone, so it's a hormone too. So that's the only thing that's going to actually keep and actually will build bone. And so everybody needs it.
Absolutely.
Right?
I couldn't agree with you
And
more.
and the hormones, again, we're going for gold levels, minimizing side effects, and symptom control, but all of them are protective, bone, brain, and heart. And so important to be on, for life, unless if there's a reason. We've talked about this in the past, so we're just doing screening mammograms once you get to the point where you need estrogen. So, then it changes a little bit, but that's our job, is to make sure that it's safe for our patients. So definitely. And I love hearing that it's easy. That's what we want, draw blood, and then we're going to sit down and go over everything.
And you did.
And then,
you went exclusively. We did that before I went in to have it done. And you were so great at explaining every bit of it to me. And it all made sense once I looked at it. But I think one thing too, and maybe I'm just blessed, but I've had no side effects. I don't even want you to tell me about the side effects because I don't want to just think that I have them, but I've had none. I've only had great results from it, and I'm just excited to even get the levels because just like you and I said, I could probably even up my levels a little bit.
Mm-hmm. Yeah, and the first time we're not always perfect, but then you'll know because some people will come in and they'll say, I feel better, but I could feel more energetic. So
Yes.
it'll go up, or, I have a sex drive, but not what I want, and so we'll know to adjust the second time. And, it usually might take us 1, 2, or 3 times, with pellets to kind of get them to an optimal level for them, which is all individualized. But yeah,
Start slow.
eventually- Yeah.
Start low and go
Start
slow.
low and
I
go
like
slow.
that.
Mm-hmm.
I like
Absolutely.
that. Customize it for people.
Customize. It's all individual. Like,
Yes.
there's some
individually
goal
done.
ranges, but it depends on the person. So,
Mhm.
well, I love your, and it's great for skin. Great for skin.
Really?
Glow
Yeah.
afterwards.
Oh
Yeah.
yeah. Absolutely.
So I
Yeah.
look even better now.
Yeah.
That's wonderful.
Yeah. Great for skin too, which is Christina works for ZO, our favorite skincare line. So yeah, she is looking fabulous. Period. She looked fabulous to begin with. She didn't need to.
You're sweet.
And she's very consistent with her skincare too.
She's
In
definitely
addition
extra
to-
glowy now.
Extra glowy for sure.
Well,
That's
part
right.
of that could be some of the things Marissa's done too. Let's be honest.
Yeah. Yeah, that's true. Well,
We've
when-
done some stuff with her too, so that could
Yeah.
be part of my glowy too. It all goes together.
That's right.
All works
Absolutely.
together.
Vitamin
Well,
D,
you really
glutathione.
cannot absolutely have sustained results with any of the aesthetic treatments without optimized hormones. So, because you're going to continue to get, collagen that breaks down. It's not building. You don't have healthy, cells. Your cells aren't optimized. So, yeah, you got to have the hormones too. So you're just going to continue to look more fabulous with time.
Well, I feel like a new woman too.
I know.
So that's even better.
I know. I love it.
I do too. Thank you.
Good. Well, I'm so glad you guys that we actually had the conversation. We're talking about skin and
I
somehow
know
it
it.
moved to hormones, and I'm so glad it did. So,
I am too.
yeah.
Very, very, very grateful.
Well, thank you for sharing your experience. Women want to hear it from you.
Oh
They want to hear it from other women that have went through what they're going through, and just know that the procedure isn't that bad. Getting blood work done and going over it isn't scary. Just opening up to an office and providers that you trust it's a very easy process. We want to make people feel comfortable with that because it's a sensitive topic and not many places you can go, right? Like the family's not talking about it. The friends aren't necessarily talking about it until you have it done, right? Then you bring it up and they're kind of shocked. And
they're
they
all
never even
shocked
thought
and
about
like,
it. Yeah.
oh my gosh, I never thought to do it myself. So I think there's the education on it needs to go up too.
Yeah,
Just
no,
like with other
absolutely.
things. We need to be educated that there's something out there that can help. And I think me talking to my friends
Yes,
and people
yeah.
that I know about it, it's just opened a lot of eyes too.
Yeah.
On like, wow, there's really something out there that can help. Because there's not a lot of talk about hormone therapy.
Yes, no,
Um,
absolutely. I agree. Well, thank you very much for being with us and
Thank
sharing
you,
your experience.
Christina.
And you too, Marissa, for sharing. And we always recruit Marissa into the podcast, even against her will
I'm the
occasionally.
whisper in the
we-
background.
Yeah. But it is about education, and that's why we're doing the podcast, so that we can get the word out there to women and to men, and solutions and changes that you go through, and the solutions are there. And so please share this with friends, anybody you think might want to hear more about it, and definitely comment if there's anything you want to hear more about, or if you have experiences you want to share. We would love to hear them. And then subscribe, again, share with friends. And just remember, we're here to revitalize your look, your health, and your sex life. Thank you.